Good afternoon, everybody, and welcome to our lunchtime learning series webinar on the impact of COVID on disabled people's participation in physical activity, which is quite a mouthful. Just wanted to say a warm welcome to you all this afternoon. You'll have noticed we are recording, so if you don't want to be recorded, please keep your camera off. We will be spotlighting the speakers during this session, so it should only be speakers who are appearing on the screen. There are also closed caption subtitles. You'll notice at the bottom you can turn those off if you find those distracting or don't want to use them. So yeah, just a few housekeeping matters before I hand over to our speakers. I just wanted to say a huge thank you to Nicola File from the Activity Alliance and Claire Burgess from the Surrey Coalition of Disabled People for their input and support with today's webinar. If you could try and stay on mute while speakers are speaking, that would be helpful just to reduce background noise and feedback and so on. Bless you, Claire. And there will be an opportunity for Q&A at around 1:45. So by all means, do come off mute at that point and feed into the discussion. As you may be aware, this is one of a series of webinars as part of our role at Active Surrey as the lead for physical activity within the county. This is the 7th of our series so far. We've had over 220 people book on to those 7. We've got another 7 to come, but we're adding to that list constantly. And do let us know either in the chat box today or by email or any of the other mediums if there are topics or speakers you'd particularly like to hear from. And just a plea, we will do a little poll towards the end of the webinar just to gather some feedback. Very informal, but it'd be really helpful if you could feed into that. So without further ado, I'm going to stop sharing my screen and hand over to Nicola.
Well, thank you very much. Right, time for me to share my screen then. This one. Lovely jubbly. So yeah, thank you very much for inviting us along today. Thanks, Laurie. And the other thing to mention, as well as that I'm Nicola, I'm from Activity Alliance, is that my colleague Lorraine is also on the call. So you've got a bit of a double act from Activity Alliance today. So hopefully she might be able to help with some of the questions a bit later on too, if I can't help. So yeah, so I don't know if anyone knows who we are as Activity Alliance. We are a national charity, first and foremost, and my role is looking at, as an engagement advisor, is about how we can support organisations who are delivering on the ground to be more inclusive in what they're doing in order to get more people, more disabled people, more active. I'm going to be talking about some of the insight that we've been collecting over the last, well, how long have we been in this? Just over a year, 18 months. Of the pandemic, and then also talking a little bit about our new strategy that we released last month now. So yeah, that's kind of what I'm going to be talking about today. So the data that we've got, I'm going to be talking about is first and foremost from our annual disability and activity survey, which is our annual, as it says in the title, kind of data collection and kind of insight that we've done for 2 years now. So we've got some comparisons, which is great, as well as picking up some data from other places, so from Sport England data and the Office for National Statistics and other places too. So if there's anything that you want more information on, please do let us know. I could easily do a 2-hour, 3-hour kind of workshop on all of the data we have, but luckily you don't get that today. But if there's anything else you need, do let us know. So first off, I'm going to kind of talk about where we were prior to the pandemic. It's useful to have a bit of a background to that. So the news was good prior to the pandemic. We did see that activity levels amongst disabled people were increasing. We're going in the right direction. And I say we, as the royal we, very much you guys delivering on the ground, people that are actually making a difference out there. So we were making steps in the right direction. The most popular activities were kind of walking, fitness activities, cycling, swimming, and then fitness classes. But disabled people were still almost twice as likely to be inactive than non-disabled people. So we were making a difference, but we still had a long way to go. So that's kind of where we were. Then the pandemic happened, and it's been a bit of a mixed bag, really. I want you to all kind of cast your minds back to April last year. The weather was glorious, much better than the April we had this year. We were all being told constantly that it's important to go outside and get your hours exercise that we're allowed to do. But there were still some inequalities emerging. So while there was kind of a bit of a buzz and a bit of a novelty to the pandemic, activity levels were higher than we're seeing now, but there were still inequalities that we were seeing. Oh, a big old bee's just come in my flat. So if I start shifting about, you know why. So then kind of moving down into May, it was still increasing. We were still on that kind of upward shift, and attitudes were becoming less positive, especially for disabled people. Then we had the summer, and bringing us into kind of September, October time, when we had the Kent variant kind of kicking about, and people going back to school, things are starting to look a bit more negative, and there were more cases, more hospitalizations, and physical activity levels were a real new low level, lower than we've ever seen before, and that is for both non-disabled and disabled people. Really, really low. It did pick up a little bit as we went into the kind of second full lockdown that we had in November, but inequalities were still very much continuing. We saw lower levels for disabled people, and you can see a difference there for non-disabled and disabled people, and that's because of the guidance that we had at that time, and I think continued all the way through the third lockdown as well, that activity for disabled people was still allowed to continue, where it wouldn't be for non-disabled people. So that's why you can see the gap is a little bit smaller there. And then more recently, February to March this year, the lockdown roadmap was released. We had a picture into what life after lockdown might look like. We could see what was going to be opening up and when. And we have seen a bit of a gentle increase for disabled people and quite a significant increase for non-disabled people too. But the inequalities are very much still there. And that's all from Sport England data, and that's, yeah, you can pull that off their website yourselves if you want to look at it into more detail in your own locality, and this is the national picture. So just over half of disabled people feel like they've got the opportunity to be active, and that's compared to nearly 3/4 of non-disabled people, and half of disabled people are worried about leaving their home to be active. And actually that number probably hasn't decreased a lot, even considering the restrictions being eased and vaccinations rolling out. There's still a huge amount of disabled people that are worried about leaving their home, even though, yeah, as I say, they're not necessarily shielding anymore. That guidance might have been kind of forgotten about, but it's still really important to a lot of disabled people to be safe at home, and they're just not comfortable leaving their house at the moment. We know that disabled people are less likely than non-disabled people to have found different ways to be active during the pandemic. And I'm going to be talking about the reasons why this might be and the barriers that disabled people are facing in the next slide. They're going to be less likely to be using exercise to manage their physical and mental health or mental health than non-disabled people, and actually just have the time to be physically active. I know a lot of people, especially towards the beginning of the pandemic, found that they actually had more time. They weren't commuting, they weren't having to, drive to all these places or get on a train. So they felt like they had more time. And actually this wasn't necessarily the case for disabled people. So yeah, lots of things to think about. But talking about barriers, there's a huge amount of barriers that have been created just from the pandemic for disabled people, far more than for non-disabled people. So we're going to talk about a few of them, and then also talk about how we might be able to overcome some of these. So the top barrier is self-isolating at home. And as I said, there's going to be a lot of disabled people with long-term health conditions that are still isolating at home. And that's far higher for disabled people than non-disabled people. I think what goes hand in hand with that is the fear of contracting coronavirus. And if a little bit further down, there is also there should be one about, maybe not, the fears of being unable to socially distance as well. So they do really go hand in hand, making sure that people have got the right measures in place, have communicated what measures they've put in place in a suitable way, that so people do feel that they understand what's going to be in place and how they're going to be kind of working and what's going to be happening for them. So really making sure that you get the messaging right for people across the board, disabled and non-disabled alike. High up on there is actually the impact on their physical and mental health. We're seeing a lot of deconditioning across the board, really. I know myself, I haven't been as active as I might well have been if I was able to, you know, still go to the gym or go swimming or whatever it might be. So, and that's just me. So across the board, especially with a lot of musculoskeletal conditions, there's been a huge amount of deconditioning because the people haven't been able to get access to physios or hydrotherapy or whatever it might be at different points throughout the last year and a bit. And then mental health as well, the amount of anxiety and just worry about being active and doing it in a safe way has been absolute. It's just how high that is at the moment is crazy, really. Lack of space at home is a really basic one, actually, but you don't think, I mean, people don't often think about it, but just not having the amount of space at home as other people, due to a lot of other inequalities that we see. So we also know that disabled people are more likely to be in lower income households, so maybe haven't got as much space or live in a, you know, more family members within one space, so haven't got the same amount of space as other people as well. So yeah, I could talk about these for quite a long time, and this list isn't exhaustive. This isn't every single one, and there are a lot of barriers that do affect disabled people and non-disabled people alike, as in things like just the venues being shut or not being able to access different pieces of equipment as well. Although a lot of the equipment needs of disabled people are higher than for non-disabled people. They need more specialist equipment. So yeah, there's a lot of different reasons, and I say we could go into this for a really long time, and there's a huge amount of this information on our website in all of our research. So if there is anything that you want to drill down into a little bit deeper, do let me know, and I can help point you in the right direction, or let Laurie know, and we can get that sorted for you as well. So as I was saying, communication and getting the information out there is really, really important. We know that disabled people were more likely to feel that they didn't have enough information on how to be active, and that's almost twice as many said that than compared to non-disabled people. So what we did is we tracked the sources of information that people would like to use or have said that they would like to use, and actually during the pandemic we saw that all sources saw a fall in use except for social media. So social media has been really important during the pandemic for people, but it is not the be all and end all. The digital divide is still very much there, and it is, before the pandemic, we knew that it was 21% of disabled people had never used the internet. I imagine that number is a bit lower now, because the pandemic has kind of forced digital to go a bit quicker than it might have done otherwise, but it's still not the be all and end all at all. You've still got to make sure that you're using the methods that people would like to be communicated to by, whether that being posters in their in the local area, or via people that they're trusted, they're trusted people. So a lot of the time that is a healthcare professional, someone that they feel can understand their condition or their impairment and really give some solid and sound advice about what physical activity they should be doing. Friends and family is also hugely important, but the bottom point here is that disabled people are more likely to listen to the government and friends than in the last kind of year. So that is important as well. We know that a lot of people have been really relying on kind of the government restrictions and everything to feel like they are safe by what they're doing and should be doing things by the book, as it were. So yeah, that's still really, really important to people. So what we're going to be doing after lockdown, we're kind of at that point now. We've seen a lot of restrictions easing, and we're being able to open up more activity, which is great. But what should we be doing, and how should we be doing it? And there is good news. We know that disabled people do want to be more active after the lockdown. That's almost 8 in 10 disabled people have said that, and that's compared to 57% of non-disabled people. So it's really, really good news that the want and the need is there. We just need to make sure that we get it right, do it in the right ways, and communicate it in the right ways to ensure that people feel as safe and that they are able to do it, to take part as they want to. It's also important to remember that it's not going to be a one size fits all for this. A lot of people may still want to be active online. That might have been actually a huge benefit for people, being able to do it in their own time, in their living rooms, without having to kind of drive for 20 minutes to the local leisure centre or whatever it might be. So there's definitely not a one-size-fits-all model here, and there never will be, there never has been. It really is about understanding who you are delivering to and who are your kind of service users, as it were, and what's important to them and how it works. The social element is still hugely important, if not more important than ever, with physical activity. So yeah, lots of things to consider. The list of kind of what disabled people and non-disabled people would like to do activity-wise is fairly similar for both groups of people. But yeah, lots of things to consider, and we're going to come on to those in kind of the recommendation section of this as well. So as I said, we know there's going to be far more challenges to taking part for disabled people. And a lot of those are going to be about, as I say, deconditioning. Strength has been declining, and that's more so for disabled people than non-disabled people. They're going to say their physical capacity and fitness has decreased as well. So actually, maybe they don't feel like the sessions that are being put on are right for them anymore. Maybe they feel like they're going to have to do something a bit different, or maybe they're not sure that the instructor, the coach, whoever it might be, is going to be able to tailor it suitably for them. So actually, is the activity that they were doing still the right activity for them? Maybe they need to try something else first to build up their kind of fitness and their capacity to be more active in a similar way to what they're doing previous to the pandemic. So maybe, yeah, a kind of weekly, bi-weekly walk or something first, to then kind of building into different activities when they're feeling more confident. And yeah, the vaccine rollout is having a positive effect, but as I say, less so for disabled people. The amount of worry and anxiety is definitely still there for disabled people. So yeah, it's 44% of disabled people said the vaccine rollout has made them less worried, and that's compared to 55% of non-disabled people. So yeah, there is a big difference there. And I don't think that number has changed significantly in the last couple of months, considering kind of the steps that we've been taking and the different variations that we're seeing as well. So that's a lot of information, and I appreciate that there's a lot of figures and stuff in there as well. So really, the most important things to take away are our conclusions and our recommendations. So the data that we have collected from our annual disability and activity survey was collected in kind of the autumn time last year, which was quite an interesting time actually, because that's after the summer when we've seen things start to open up again, and was actually when things are starting to take a bit of a downturn again. But what we took from those was we were able to collect 5 key points, 5 key recommendations that we would like people to really put into place to ensure that we're doing things in the most inclusive way as soon as we can. Really, the best thing to do is to build inclusivity in from the get-go when we're reopening, rather than trying to bolt it on at the end. And it's more time, it takes up more time, it takes more money and costs. So yeah, really do try and build these in right from the beginning. So our 5 main recommendations are: the first one is to provide information. So there's been a lot of confusion for both organisations and people themselves throughout this pandemic. Restrictions have been changing, guidelines have been changing. So really, organisations do need to be better supported to be able to confidently provide the guidance that they need to do for their people. So we have put together kind of our inclusivity guide, which we can definitely share with people to try and make it as simple as possible for people. But yeah, really do provide clear and concise information for people. And we've got our inclusive communications guidance as well to help do that. One way that we found has been really effective actually for communication is videos have been really helpful to kind of do like walkthroughs of different facilities, being like, this is what this section is going to look like, or this is going to be your route to the changing rooms now, or whatever it might be, just to give people a real kind of a real sure way of understanding what's going on and what is going to look different, what's going to be new. Are they going to be able to still use this piece of equipment they've used before, even if it's in a different place? So really just give people as much information as possible. The second one is about embedding inclusive practice. As I said, inclusion needs to be at the very heart of what we're doing when we're reopening and all of our redevelopment. So use our 10 principles that we've developed and our training programs if that's good for you. We've got our inclusive activity program, which is an online classroom that people can do, but there's also a free e-module that people can do online, which only takes about an hour. And I really would recommend that people do that because I'm not sure how long it's going to be free for. So now is the time. And then our learning from our programs that we've got, we've had our Get Out, Get Active program that's been running. It started in April last year, which was a really good time for that program to start, but it actually meant that we've got a huge amount of learning from GOGA that we can share with relevant parties about working with different populations. So there's kind of Alzheimer's, there's the lower socioeconomic groups, there's a huge amount of people that are working with that, so we can share that information too. Next up is working collaboratively, and this is hugely important. So particularly with the health sector and community organisations, we need to work better together there as well. And also just sharing all the learning that we have as a group, and just even putting things like this webinar together are really, really helpful for working collaboratively. And I'm sure the guys at Active Surrey will be able to kind of help share some more learning that we've got and best practice, and also what's not worked so well, because that can be just as helpful to share amongst organisations like yourselves. Number 4 is offering a variety of ways of being active. So as I said before, there's no one group of disabled people. Everyone is individual at the end of the day. And even within specific impairment groups, there's no one right answer on how to help them be more active. There's still preferences, whether it's staying at home or going to the gym, at the first opportunity that people had, or feeling safe to go just for a jog outside, or I say just for a jog, I haven't been for a jog in a long time, but going for a jog when you're able to. We need to appeal to different motivations that people are going to have now. So it might have been that prior to the pandemic, their main motivation for being active was to increase their fitness. But actually now their main motivation may be for socialising and managing their physical or mental health. So there will be different reasons why people want to be active, and we need to offer different ways of doing that to make sure that we're appealing to everyone. And last but not least is changing attitudes. To help disabled people to be fully included, we still need to work on increasing the visibility of disabled people and challenging perceptions on impairments and building confidence and competence as well within the workforce for us. So that's another reason why this webinar is really great, just being able to kind of share some of the insight that we have. As I say, I could be talking about this for a very long time, but there's a huge amount of information on our website. So do please have a look at that. If you want to read all 100 or odd pages of our survey, you can do, but there's also a nice summary. It's a little bit shorter, which I'd recommend starting with. So that's everything for our insight that we've got. And I really just briefly want to talk about our new strategy. It came out last month. It's nice and simple. I like simple things, makes it easy to understand for me, if no one else. And our vision is now fairness for disabled people in sport and activity. We talked a long time about what that first word should be. Should it be equality or equity? But actually fairness is what we're striving for. And we've got 2 organisational goals to help us close the fairness gap between disabled people's level of inactivity and that of non-disabled people. And they are number 1, to embed inclusive practice into organisations, and number 2 is changing attitudes towards disabled people in sport and activity. So you can see how our recommendations are really kind of fitting into our organisational goals as well. We've got 4 organisational objectives, and I'm not going to kind of spend too much time on this, but we're going to champion disabled people's voices and maximise our impact and visibility. So things like today are really good for us. Use our high quality expertise and insight to educate, inform decision making and influence policy, and that's at a local level as well as at a national level and further beyond. We're going to address inequalities through collaboration, improving engagement and delivery for and with disabled people, and that's really important, is that co-design and co-delivery kind of element of our work, and maximise and use the investment of our partners to enable disabled people to be more active. We have core values as well, and I really like these. I think these really sum up how we work and why we do our work. So first off is that we care, second is we unite, and third is we champion. So that is us in a nutshell. Our strategy, as I say, is very new out. There's a nice glossy version of it on our website, so do have a look, and if there's anything that we can do collectively to help close the fairness gap, please do let us know. And that is everything from me. And I think I'm going to pass over to Claire now, if that's, or am I going back to you, Laurie?
Thank you so much, Nicola. That was
worries.
Great. Kept time, and yeah, ready to hand over to Claire now. I don't need to
Brilliant.
say.
I'll stop sharing my
screen.
screen.
The Q&A.
Thank you, and I'll just share my slides. Okay, so hopefully you can see those. So hello everyone, my name is Claire Burgess and I'm the Chief Executive of Surrey Coalition of Disabled People, and we also coordinate the Independent Mental Health Network. I'm going to talk to you today briefly to think about the impact that the pandemic's had on the disabled community and physical activity in Surrey. And I thought I would just give you a bit of a summary about what we were hearing early on in the pandemic, how that's changed over time, and then the current situation, so the current barriers to participation that we're hearing a lot about, and some of the recommendations that our members have given as to how providers and other organisations could help to tackle those barriers. And then finally, wanted to just give you a very brief introduction to our new Get More Active collaborative project. So what we were hearing early on in the pandemic then, and it really reflects the national picture that Nicola shared with us, which is helpful. So early on, people were struggling to have their basic needs met. So the things we were hearing about a lot were people having access to food, to care, and to human contact, really. And physical activity seemed to not particularly be on people's radar early on, whilst they were struggling with those very basic needs. And many inclusive activity workers were furloughed, even in some cases when mainstream staff were not. The disabled community seemed to really miss that point of contact and support. And when we were speaking to groups about accessing some of the new types of ways to be active that had popped up, and in particular virtual, there was a real lack of knowledge about what was available and where to look. There was concern about accessibility of what those classes would be like. There were issues with just simple access, so having space at home, having the right equipment to participate, having care support to participate, financial concerns, particularly around data. Some really interesting feedback from people feeling exposed, particularly people with a mental illness or mental ill health, and even more specifically, those people with like a hoarding disorder were very concerned that they would come under pressure to turn their cameras on, for example, and people would see into their homes. So that was one we heard quite a lot about. And then, as I said, people not having access to their usual care workers. And as you're probably all aware, early on in the pandemic, when care workers were really struggling with COVID and the restrictions, quite often people where they might have had 4 visits a day pre-pandemic, that was being cut right down because care providers just couldn't deliver the usual levels of care and support. So I wanted to tell you a bit of a story about one of our members, Lorraine, and in particular in those first kind of 6 months of the pandemic. So Lorraine's in her 50s. She's blind, so she's registered as severely sight impaired. She had really good digital literacy already, and she had access to a device at home. She wasn't under any particular financial pressures either, so she had Wi-Fi. She was very active. She used to use her guide dog every day to get her to her nearest leisure centre and would work out in the gym every day. During lockdown, she continued walking on some of her known routes with her dog. She obviously couldn't work her dog to the leisure centre to use the gym because it was closed. She couldn't extend her routes because she wasn't able to get access to a mobility instructor to help her do that because they had been furloughed. She really wanted to maintain her excellent level of fitness. She wanted to participate in some of the virtual Les Mills classes, and she tried a couple, and she just found that the verbal description wasn't quite adequate for her to be able to participate. She then switched and she said, okay, I'll do some online seated classes, but she just found them too easy. And what she really wanted was to be able to join mainstream classes online, but for them to have a good enough verbal description, or maybe a kind of introductory week that would take her through some of the moves that they use a lot so that she could kind of have a practice. And then over the course of the pandemic and how that shifted, so we started to hear from people who'd managed to sort out those very basic needs like food and care, and then they were craving social contact, and physical activity was very much coming into that, really, with the things that they were wanting to do. Heard from a lot of people who just didn't know where to start to look for accessible activity, and were almost kind of overwhelmed with all the options and all the different places to look. We started to see some really nice peer sharing and peer support going on when people had discovered new activities and were happy to share how that had gone with others. And members really talked to us about the need for one place to go that would hold all the information, and then some hand holding to help them navigate to the most appropriate opportunity. And then more recently, so in many ways, the pandemic responses seem to have rolled accessibility backwards, particularly in terms of the built environment. So you've probably all seen it yourself when you go to a supermarket, or it might be to a leisure centre or a shopping centre. The temporary fences that have been put up in places to put in things like one-way systems and all that kind of thing. That's been really challenging for people, particularly blind people who've learnt a route, for example, and then a year later they've gone to do that very familiar route, and all of a sudden there's like a temporary barrier that's been put up. Or I saw one the other day, for example, where an electric doors, it had been narrowed to make it more that people would go in one at a time, but by making it kind of narrowed, it meant that an electric wheelchair couldn't go through it. So some of those basic accessibility things that we've kind of taken for granted nowadays, unfortunately, it has rolled right back. The majority of the people we're hearing from are still shielding to some extent, informally, even though, you know, official shielding has ended. And most of the people that we are speaking to don't have any intention to stop shielding. That there is a huge level of fear still about COVID in Surrey, and people are terrified to leave and be out and about. More positively, many of our members, particularly those with a physical disability, have reported being able to engage in much more than they could in normal times. And I think there is some anxiety in that group that actually they might be left behind when things do go back to some kind of normality, which is interesting. So I wanted to share another quick story with you, which is Mark's story. So Mark is one of our members. He's in his 30s and he has MS. He used to love swimming, really fit guy, used swimming a lot to help manage his pain. During the pandemic, most of his therapies had to stop, and his pain increased. His conditions progressed, unfortunately, during the last year. He's had both his COVID vaccinations and had them very early on. And when we started to talk to Mark about when he might be able to return to the pool, he said this sentence, which is, "I'll never go back. It's far too dangerous now with COVID around." And I just kind of wanted to share that with you, really, because I thought it was so stark that Mark and many more people like him are thinking this is forever, that that he can't, you know, participate in the physical activity that best suits his needs. And when we asked our members, when we told them we were doing this and said, okay, what would help you to get more active as we recover from COVID? The 5 things that they said to us were to prioritise access to physical activity for disabled people. So, for example, making sure that there are times in the pool, a decent amount of time where it is a quiet session to help reduce some of that anxiety about social distancing and transmission. Clear information and advice about what's available, which echoes Nicola's point quite nicely. Reassurance and time, and appreciating that some people have deconditioned and lost fitness during this time. Organisations and providers reinstalling the accessibility, particularly around street design, and thinking about temporary one-way systems and barriers. And every time we put one of those things in, we potentially make it an inaccessible environment for other people, and thinking about how we can minimise that. Making sure things like hearing loops are working, having not been used for 18 months. Thinking about our staff wearing clear masks so that people can still lip read. All those kind of simple quick wins really. And then not a simple quick win, working to rebuild trust and confidence in helping people to get out again, and to believe that it's safe, and also to believe that the the needs of disabled people are being prioritized. I think that the disproportionate mortality figures for the disabled community during COVID really speak for themselves, and people are very aware of them and feeling quite vulnerable and scared. And then a quick introduction to the Get More Active project. So during the course of the pandemic, we've been talking to Active Surrey and other partners about how we could help with this situation, and in particular, people becoming more physically inactive. So we worked to put together a collaborative project, which was funded by Active Surrey through Sport England Tackling Inequalities Fund. And it's a project around physical activity navigation. So we've employed a physical activity navigator who's part-time, and she started in April. And her work's in three main areas. So number one is she's offering one-to-one navigation support and advice appointments for people around those people that want to get more active and just need some help to find the right opportunity for them, and maybe some support to do that too. Number two, she runs a weekly peer support group where people are able to come together, share experiences, they're able to flag up any problems that they've had so that they can offer each other the support required to overcome that. And then number three, she's working on a physical activity library, and a library sounds really boring, but she's doing lots of kind of blogs and vlogs and video tours and that kind of thing of different facilities and different activities, so that there's one place to go for all the disability activity in Surrey and beyond, because there'll be some national stuff in there too, I suspect, as well. So as a specific example, she at the moment is working on going to different leisure centres to see what any new accessibility arrangements they've put in place during COVID are, so that that information can be shared with people to help reduce anxiety about going there. A second thing that she's working on, which I think is really exciting, is bringing together all the accessibility information for every park run in Surrey into one place, so that you don't have to go to the park run website for every single venue to see which one regularly has a BSL interpreter, for example. So you'll be able to just see that from the one spot. And I think that's it for a bit of a summary of that project. So I'm going to stop sharing, but needless to say, if you'd like any more information, please get in touch with us. We'd love to hear from you. If you could help us by promoting the project, that would be amazing. People can either self-refer or be referred, that's fine. And you can email us on getactive@surreycoalition.org.uk. There's an example on the screen of our flyer. If you'd like me to send you some hard copies or an electronic one, please let me know. Thank you very much.
Thank you, Claire. I guess just to say, we will make, if that's okay, slide decks available to people afterwards, so you can obviously access those links that Nicola and Claire shared.
Yes, of course.
During their talk. So thank you so much. If it's okay, while people are thinking of questions, so do raise your hand or stick something in the chat box if you have a question that you want to ask. I suppose just to get things started, actually, I noted one down, and I guess it kind of draws on that final point of yours, Claire, actually, around what can we do collectively around kind of messaging about the safety of returning to activity, and I guess concern about, you know, people withdrawing from society and feeling that it's never going to be safe for them to return. I'd be interested kind of from both of your perspectives, actually, about what can be done locally and nationally, I suppose, to tackle that problem, really.
I'll go if you want first, and then I'll hand over to Nicola. Good question, Laurie. I think that locally there's probably lots of opportunities to think about buddying schemes and peer support and that kind of thing. So almost matching people up with someone else to go to something together. I think that we probably need to do some education sessions as well about what the risks are at that time, how people can minimize their risks. And also some of the stuff that Nicola mentioned earlier, like the video walkthroughs and these are the precautions that have been put in place. This is why you can feel safe here, all that kind of thing.
Yeah, I completely agree. I think using the trusted individuals that people are are used to. So your medical professionals, your physios, people that are doing the hydrotherapy sessions, or even if that is people's, friends and family, whoever it might be, who are those trusted individuals that people do feel safe with. Or actually, the buddying system sounds like a great idea for friends and family especially, but really making sure we're using the right people to kind of recommend and say, look, I did it last week and this is what happened almost. So
Thank you.
And I think maybe there is, it is us being honest and transparent about the risks and thinking, okay, and not trying to minimize them too much. And actually, if people are so terrified of the idea of swimming indoors, can we find them a provision for some outdoor swimming? And I guess it's looking at those alternatives. And that really feeds into what Nicola was saying earlier about choice and control, and making sure that there are that array of different choices that people can choose from.
Yeah, and understanding that people aren't going to necessarily go back to the same activity. It might be that it's a completely different activity that's the right choice now for various different reasons, because they feel more safe outside or whatever it might be. So and really kind of offering up a variety of options.
Do we have any questions from anyone watching and listening? Just, I suppose, thinking about some of the people who are on the call, we've got certainly 1 or 2 leisure centres here, I think. So in terms of, I guess, if there's, I guess, like you've both described, kind of showing people how safe it is and how it could feel. You're happy for people to get in touch with Katie and then perhaps do you generate some content that way, I suppose, to help?
Yeah, please, would be very happy to do that. Yeah.
The other thing that I probably should have mentioned that I completely forgot is around actually paying for activity now as well. So a lot of things that have gone to kind of card only or contactless only is actually making it far less accessible for people, because especially people with learning disabilities, they their money management is actually they're given so much per week or so much per day, and cash still does need to be an option for a lot of individuals. So just thinking about having an alternative, whereas majority of people will still be able to use contactless, but it can't be the only option. There needs to be a variety of ways for payment as well, definitely. And online payment and online booking also isn't always the most useful for some individuals too. So just having those variety of payment options too.
I wondered if I could make a comment. It's Tracy, Adult Social Care. With the help of Surrey Coalition, we managed, it wasn't an active support, but in between lockdowns, we managed to support people, some with disabilities, in a local setting. And what we found is not everyone has technology or the ability, but they felt very, very safe, COVID safe, in small groups, social distance, with PPE and hand sanitizers supplied. So we are using that kind of model because, as well as people with disabilities, elderly people and people who have underlying health issues are feeling exactly the same and are isolated. So you could use that model to do smaller setting exercise groups. That I mean, one of our sessions was actually falls prevention and low impact exercises, one of the 6 sessions. But everybody seemed to really love that. And one person hadn't been out for 6 years. So it wasn't just to do with the pandemic, it was encouraging people who were anxious already about coming out.
Brilliant.
Thank you, Tracy. There's a question in the chat box. I'll just read out to you. Do either organisations provide outreach support to parents of disabled children?
That's not something that we do directly. No, we'd be looking to work with partners on the ground to do that, because as a national organisation we couldn't do that, but it's the kind of thing that I talk to Laurie about, to be honest.
Action for carers.
And I would really recommend Family Voice Surrey as well as a really good point of contact. Yeah,
they're a great advocacy group for parents of disabled children, definitely, and do quite a lot of parent and child voice work, as their name would suggest, actually, in terms of
and they're good for sort of connecting into the right support as well, I think.
Any other questions? Otherwise, I think I had one, Claire. Actually, can you tell us a bit more about the library that Katie's developing and how people can feed information into that, or how people can access it?
Yeah, of course. So it's early days, but it's going to be hosted on our website, so on the Surrey Coalition website at the moment. And at the moment, we're generating that content according to kind of what disabled people are telling us they want to hear more about. So there was some information recently mapping out all the outdoor gyms in Surrey that people wanted to know a bit more about. And then there's a kind of user experience of how this person keeps fit by using outdoor gyms. And so there'll be all kinds of video stories. That the main priority for us was that it should almost be kind of service or class reviews by disabled people for disabled people. So rather than it being quite dry content, we wanted it to feel quite engaging and real. And if any providers would welcome or tolerate us coming to not evaluate, it's the wrong word, to find out more about your service and then share that with the disabled community, then we would bite your hand off. We'd really love to. So please just get in touch with us.
That's a great offer. I'm sure there'll be some uptake for that, Claire. Okay, last chance. Anybody, if you have any questions, just shout out or stick it in the chat box if you don't want to talk. Otherwise, I think we'll draw things to a close, and I know Claire's got to leave in a couple of minutes anyway, and let you have a bit of your lunch break back. Maybe get out and get some fresh air. Okay, thank you very much to Claire and to Nicola. That was really great. And yeah, we'll share the slides with people afterwards, and obviously the link will go up on YouTube, and be able to share that with other colleagues or people that you know who may be interested.
Great. Thank you very much, everyone.
Nice to see you.
Thanks.
Bye.